Well, Charlamagne, thanks.
Yes, sir.
Thanks for coming. You know, you've invited me on the Breakfast Club. This isn't exactly a Breakfast Club invitation, but we're really glad you're here, and we're really glad
Thank you for having me.
This is Dr. Craig Walker.
What's up, Dr. Craig? How are you?
Dr. Craig Walker is the founder of New Cardiovascular Horizons, ncvh. For over 25 years, has been disseminating knowledge, education, research throughout the country. And Dr. Walker's practice in Louisiana, Mississippi, Florida, upstate New York is one of the largest cardiovascular practices in America. So today we're here because we really want to get your perspective on ways that all of us as practitioners can help improve healthcare in the Black community. We started by putting up a slide that you can see down here, and everyone can see that slide. That's data from Boston Scientific Close the Gap folks. I really want to make a shout out to Trish Soliday there, who is a dedicated servant to this cause and works for Close the Gap. And she and I have worked closely together the last several years. And she provides me this data from Medicare from Kings County, Brooklyn. And if you look at the bar on the left, that's the number of white men who get coronary interventions, stents, revascularization in 2023. And then the following bars, next, the blue bar are white women. Then the purple bar, male persons of color, and the lavender bar, female persons of color. The gray bars, though, are persons of color or women who have heart disease and yet don't get treated. And in fact, if they got treated at the same rates of white men, Charlamagne, that would be an additional almost 2,200 patients. So I'm just curious, I know you advocate, but when you look at things like this, what goes through your mind and what your thoughts are?
I mean, I think it's a complicated issue. I don't think it's, either or. I think that sometimes, it can come from a lack of information in Black communities, a lack of information. Like, I didn't even know you existed until I met you, right? So also on the flip side, you got to think of the racial disparities that exist within the medical field. So when you ask a question, why aren't Black people getting treated? That's a question for y'all, for the doctors, as opposed to a question for me, who would be a client. Why do you think they're not getting treated?
Well, good question. I'm going to get to that in a second. Mm-hmm. I want to show you one other slide because it's causing tremendous morbidity and mortality. This slide shows, this is our heat maps that shows in terms of the darker the color in each panel, the more people. So on the left panel, that's the percentage of people of color in those zip codes in Brooklyn. So you can see kind of central Brooklyn is the highest population. The second panel is the really disturbing one. That's the percentage of patients that have amputations in Brooklyn. And so you could see it's all right in the middle of Black communities. And then in the third panel, that's the percentage of patients that get diagnosed with peripheral arterial disease. So in the communities that have the most people of color and the most amputations, they have the lowest rates of diagnosis and the highest rates of amputation. So it's literally almost backwards. So clearly we're not doing something right, right? Clearly we're not getting our message out, or we're not serving these communities. But to further go to your question, why is that happening? So Trish and the folks at Close the Gap provided us with this information. This is an AI assessment of over 250,000 internet conversations. And on the left, identifies the 5 top reasons that prevent Black adults 50 or over from getting treatment. And on the right, 5 reasons that they discussed that would motivate them. So denial is a big issue.
Racial.
Right? And you talk about that all the time on the radio. But health system issues. There appears to be a barrier to care in getting into the health system.
Racial, but define health system issues for people.
So health system issues might be distance, insurance issues, navigating the system, right? And especially, again, remember, we're talking about pretty sick people, coronary disease patients, peripheral arterial disease patients. So they're 60% either are in denial or have health system issues. Now, in addition, there's a lack of support and guidance from healthcare professionals that we see, and a lack of understanding on what treatment would cause, what improvement treatment would cause. Yes, Dr. Walker.
So in addition to that, as we look at this and we look at the factors, even amongst the blacks, women don't get treated. So, and it's true, by the way, with all groups, women are also undertreated. I mean, our issues of undertreatment are a big problem across America. In fact, we have a session at our conference that is disparities in care, and we look at them, and the disparities are many. They're male-female, they're based on race, there are a lot of other things that go on. They're based on socioeconomics, and all of those issues, as we look at these. When I moved back home from Harvard, when I moved back to my town, we had a big population. I moved to a town where we have a large population of blacks, a large population of Native Americans that grew up there. And I actually went out because I realized amputation rates were so much higher in those groups. And I went into the tribal councils. I went into black churches and other things to discuss these problems. Because the other thing I saw was there had just been no communication at that level. We need, that's what I'm kind of excited about seeing you here. We need communication down to the levels. Hey, these problems exist in our community. Look around, see them, and we can treat them. But I think, in today's world, when we see all these factors, I mean, for how many years have we seen these disparities? All the way back to when I first came out, that's 41 years ago, and we still haven't done a good job in most places. I think it's a big part that if we look at Medicare statistics in the whole Thibodeau region, that's where I started the clinic, we've had the most dramatic decline in cardiovascular death and the most dramatic decline in amputations seen in the whole country.
How did you get patients educated? That's the thing, and that's what I'm at. Charlamagne.
Yeah, I think it's two things. I mean, number one, I think about, how many people can actually afford these treatments, right? And then I also think about, how much is the medical community going to these actual places? Like, it's interesting to me that you said this was a AI. What is this, an AI thing?
Yeah, that data is generated from AI assessment of internet conversations.
I wonder how many doctors actually go into these communities. Like when you show me a map and you show me where all of these disparities are, how many doctors actually go into these communities and talk to these people? Like, why did it have to be a AI assessment? When the last time you spoke to a real person in a real community about, what they're facing and what the issue is? Like, what is the barrier to the entry? If you talk to them, they'll probably tell you it's financial 9 times out of 10. Or they didn't know that it existed.
Right, because of insurance issues or...
yeah, I mean, doctors are public servants. Y'all should actually be going to the people instead of waiting for the people to come to you. And then when the people do want to come to you, you have these long waiting lists for them to, be able to see you. And then they get this big-ass bill after they see you. So I can kind of understand why, there's a disparity.
I don't have an answer to that. Anyone else have an answer to that?
I told you he applied logic to what we did. I said that before.
You were right. You were right. Right. So, in our city, there's a cluster of, these great academic medical centers, Ivy League schools. You drive up First Avenue, there's a big cluster of them. But the fact of the matter is, how do patients from the Bronx, how do patients, even, when you look at it from Harlem, actually, if we go back to this slide, Central Brooklyn, there's basically 2 hospitals there. Kings County, which is a public hospital, and State University downstate, and that's going to be closed. So we're actually taking services away. So what you're saying, the call to action here is we ought to be getting all of Close the Gap data, every single one of us, and opening our offices right in those communities. That's how you build relationships, and that's how you educate. That's right. Now, I'm curious, since you started, I mean, you're a big advocate on your show. I don't think a week goes by, I don't hear you talking about some health issue or advocating for folks. What response have you gotten back from your listeners and your audience around the country? How do they, how are they responding to it?
Well, it was, for me, I've always dealt with like really, really, really bad anxiety. And, when I when I've checked myself into like hospitals or anything for my anxiety, the first thing I think is that I'm thinking I'm having some type of heart issue, right? I'm talking about historically throughout my whole life. And so a couple of years ago, I had a friend who, passed away of a heart attack. He was overweight, but he passed away of a heart attack, and it just had me in my head about cardiovascular issues. So I did every single cardiovascular test that you could think of. And then I remember one of the doctors saying to me, just because you do these tests, you could, or maybe it was you, Dr. Puma. Somebody told me that just because you do all of these tests, you could still drop dead, basically, because there's things that are going on in your arteries that you have to see. And then that's when I met you, and you were telling me about the Sorin heart scan, where, you can explain it better than I can, but, you put the ink in you and all of that good stuff, and then they, slide you into the machine, and you see the 3D rendering of your heart and all of that, right? And so, for whatever reason, that just put my mind at ease in such a real way, more so than any of the EKG tests, more so than any of the stress tests, just being able to see it, and you telling me, X, Y, and Z about my heart and about my arteries and why these sudden strokes happen and why these sudden heart attacks happen. You explained to me the blockages that can happen, in the widowmaker. And it just put my mind at such ease that I just started talking about it, to my listeners. And that's what I go back to when I say information. A lot of people don't even know that these type of treatments exist. But, I'm in a different, by the grace of God, a different financial situation than a lot of the people that I may talk to on the radio. So even though we put out this type of information and people want to do it and people want to be involved, the reason I think it's good what you do, Dr. Puma, is you make it affordable for people to take care of themselves. I mean, we can get into a whole conversation about how America just needs to have, free health care, because it's just bugged out to me that, you people would allow somebody to die just because they can't afford to get the treatment that they need. But I think that the response has been very, very, very good. But we can have all of these conversations about amplifying whatever it is that y'all are doing in the medical field, but if people can't afford it, that amplification is for nothing.
So, listen, I agree. We take care of everyone. I've said it on the Breakfast Club, anyone that comes in. And I think our original conversation was actually organic. I think I was doing a podcast.
I saw you in the hallway.
Yeah, we bumped into each other in the hallway, and we started chatting. But what we've done with the Sorin heart scan is a coronary CTA that we just trademarked as the Sorin heart scan, because we just took disparate technologies that were already available, the most powerful CT scan in the world, the best technicians and nurses that we could find that are in highest volume in New York, and then the process in terms of the medications we give, IV metoprolol, but in addition, the partnership we have with HeartFlow, so that HeartFlow's technology is literally game-changing, and without comparison, where you get roadmap analysis, plaque analysis, exactly as you said, it's like you're taking a drive inside your arteries, and then FFR, which is functional analysis. So you get anatomy, you get plaque, which helps give us prognostic information. And the key for me is, I don't know why it's costing so much, because I could tell you Medicare, if you had Medicare pays only about 10% of the cost of a nuclear or PET stress test for this. It's simple, cheap, easy, and there's over 2,000 patients in Brooklyn that needed a coronary stent and nobody knew about it, that God knows if they had a heart attack, and that's just Brooklyn. So the real question to me is, how do you amplify this message? How do all of us get out there? How do we stop doing stress tests on patients? And Dr. Green's going to give a great presentation this afternoon on from diagnosis to prevention, on how this is really should be changing the world, and yet your experience is true. Only 5% of people in America that get a test for their heart get CAT scan, coronary CAT scan with FFR CT.
Joe, we have a much bigger question, though, that goes on, because the big bill is a big problem, no two ways about it, except in a Medicaid patient. There is no bill. The Medicaid patient comes in and there is no bill. And still, folks aren't coming in. which to me sings volumes about we're not getting the message out, that these are real diseases in these areas. And as bad as we're doing it in the black community, we're doing it much worse in the black female community, much worse in the white female community. And there are a lot of reasons. You know, females don't necessarily get the same warning symptoms. They're often thought to be crazy when they have symptoms. They often don't have epicardial disease. And so we do an angiogram and it looks good, but they have small vessel disease, and yet that's associated with high risk. And so we need education that gets out. We got to get people to understand, hey, you can have this problem. Hey, it's a big problem. And you have to take the time to address it, because it is not just even an issue of affordability that I've seen. It's an issue of knowledge. And people are fearful. No one wants to come into a hospital. No one wants to come to see a doctor. I've never seen anybody who likes to do that except my patients who like to garden. They talk to me about gardening or fishing. They like to come in and shoot the breeze with me sometimes. But the truth is, people are scared when they go to a doctor. They're scared they're going to find something that's life-altering or changing for them. You're a messenger. Tell us what kind of message you would use to get that out.
Well, people don't know y'all exist. You know, I think that sometimes, you know, we live in this society where folks think, hey, if you build it, they will come. No, you got to follow Dr. Puma's lead and meet people where they are. Like, you know, McDonald's don't ever stop advertising, and that's who y'all up against, right? That's who y'all fighting against. That's why people got to run to see y'all all the time, because of all the McDonald's they've eaten over the years. But McDonald's is constantly advertising every day. Dr. Puma, you decided to start advertising on Breakfast Club. You decided to start advertising on Power 105.1. That's what each and every one of y'all has to do if you actually care about people. Now, if you just actually care about, you know, money, you'll just sit around and, you know, you'll wait for people to find you. But I think a lot of times we point the finger at the people who aren't coming in, but do they know that y'all exist? You can't just build it and they will come. You have to meet people where they are nowadays. So that's whether it's radio, whether it's social media, whether it's podcasts, wherever y'all can advertise to get the word out about what y'all are doing, y'all have to be there.
Yeah, I think you're exactly right. We you know, everyone wants to be a doctor on Park Avenue or something at some point in their life, but the reality is, you know, we opened offices, as you know, in Crown Heights, in Harlem, in Washington Heights, in all the communities where the patients are. And in large part, from getting the information from Close the Gap, having all that data, knowing where the propensity for disease was, but there weren't doctors. These people weren't getting treated. But, you know, and then figuring out a way, and I don't want to use this in a bad way, because I don't want to talk about human beings and say the word process, but processing people in a quick and easy way to get the most information. And that, I think, has made the big difference. Being there and then figuring out a quick, easy way. You're probably right. We accept insurance. Insurance that, you know, I've been practicing now, it'll be 35 years in May. Never once put a patient in collection. We take care of everyone, and you know, we talk about it. You're either part of the community or you're not.
That's right.
Part of the community. But, you know, what I wanted today to be for all of you, and I want, you know, I know Charlamagne well enough to know that he either gets honest or you're going to feel like you're dying when you're talking to him. But I wanted today to be a call to action for everyone. We have looked at data, and now I'm going to show one additional slide, if I may, which to me is the worst slide. I started the day with it, and I don't know why we're missing our slides. Can we get the slide? Yeah, so now, right, so first of all, if you're in the communities, you can have these conversations. And this is the, you know, educating a patient, building their trust is like any relationship. It takes time. It takes repeated effort, right? And over time, you can't just walk in and say, hi, I'm a doctor, trust me. And that's part of what's been missing. You know, how many medical conferences have we all gone to when we all have these smart folks come up telling us the way we should treat patients? When was the last time we had a patient advocate up here?
That's right.
Right? And so, you know, today we decided to have a patient advocate. But, oh, we lost that one slide. I'm sorry, I was looking for my first slide, looking at heart disease. So we showed a slide this morning that #1 killer in America, 1 in 5 people die of heart disease, men and women pretty much equally. And for 25 years, from 1990 to about 2010, mortality kept going down, but since 2010, it's actually back up now. We have lost ground. And I'm going to get honest with everyone. We all need to do better here. And, you know, I don't know if it's you're working in the hospital system or whatever you think your handcuffs are, we all need to do better because we are not serving our patients well. There are so many people in this city that are so sick. You know, it's not a joke. If you're a black man in Brooklyn, there's a pretty high risk you're a one-legged black man in Brooklyn. All right, but if you're a white man in Brooklyn, you're going to get your PAD diagnosed and treated, and that's a real problem for me.
Does the medical industry ever want to wage war against the food industry?
Ask Robert Kennedy. Right? I think he's all into that. Yeah, I mean, we have a lot of bad things that have been brought in that probably are contributing to diabetes. Plus, we've made it much easier to do things. You know, now we don't even get up to change the television channel. You know, when I was a kid, you had to do some effort. Now you sit there and lay down. We have a sedentary lifestyle. We eat trash all of the time. We tend to get overweight. We don't exercise as much. Mm-hmm. We have all these other things, and so we have to change lifestyle too, for sure. And should we wage war? I think you're starting to see some of that right now with some of what's happening. And you know, a lot of doctors were really objecting to some of these new initiatives, but obviously what we're doing is failing. And when something fails, you got to try something new. I'm curious to see what's going to happen. I anxiously await it.
Yeah. You know, part of that's why I've been a proponent. You know, we talked about it on once on the Breakfast Club of these weight loss drugs. You know, Dr. Walker just gave a talk about them. It's hard to change habits, right? And if folks are sitting at home and they get Grubhub and, you know, you get a Big Mac, supersize it kind of thing, and you know, it's hard to get folks to change habits, but if they're on weight loss drugs for a couple of months, they may start losing weight, blood pressure may come down, cholesterol comes down, and their diabetes may be a little better, and then after maybe 2 or 3 months, maybe their habits change. I want to give the audience, it's really a unique experience for all of us to have Charlamagne here with us. So if it's okay with you, Charlamagne, I'd like to give the audience a chance and maybe 1 or 2 questions. If anyone would like to step up to the microphone and ask.
Good afternoon, everybody. Dr. Walker, Dr. Puma, thank you so much for doing this. Uncle Charles, how are you?
What's up, my brother?
I have a quick question. It might be an unpopular opinion, but I have to ask it. Do you think that the black community is underserved, the stats are underserved because it's relevant to that black practitioners only make up 5% of the medical community?
Yeah, I mean, because, you know, you have to have representation in that space because those people from that space know what's going on. If not, you know, you're just going to have people looking at maps, you know, for what's happening in the black community and saying, oh, you know, why is that happening, and asking questions. And, you know, of course, we know the food deserts that exist in that community, but the lack of information that exists in that community, in the black community, for people to even come and get these type of resources. So I think you need that type of representation just for people to be waving their hands saying, hey, don't forget about the folks, you know, that's over here. And let me tell you why these people aren't coming to, you know, see y'all the way that they need to see y'all. Because, like I said before, it's like, it's just interesting to me that it's a AI generated community that they're talking to, and actual people have existed, you know, for years. It's almost like it's safer to talk to the AI, but no, put your boots on and go in the hood and talk to folks. So that's why you need more representation, because those are the people that aren't afraid to go talk to the folks that need to be spoken to.
Thank you, Doc.
We'll take 1 more.
Yeah. Hi, good afternoon. I just wanted to follow up about the food. Isn't the food a driver of the obesity that you know, excessive glucose consumption, carb consumption, because our food, most of us eat carbs as our primary source of energy. Isn't the food industry playing a significant role in our overconsumption of glucose? You know, when you go to the store, you see all these juices, and juices are primarily sugar, and people are consuming these things thinking that they're healthy for them. They've eliminated the fiber once you've removed the fiber from from the fruit, and you have this pure juice, people are consuming way too much sugar. This is driving their insulin resistance. It's driving the development of obesity. It's driving the development of the fatty liver disease. So how do we get people to eat real food? Food that comes from the ground, food that's grass-fed. How do we change people's consumption of the additives that are in food? Because when you read the labels, why does a food have to have a label on it? If the food is real, it doesn't have a label. So you have all these additives that are driving disease too. So why isn't the government doing something to change that?
Well, that's a good question. Let me pose it in a little different way.
Oh, that's not for me to answer. That's
No.
That's the medical profession.
In a post-COVID world, right, where there's already trust issues, different communities have different levels of trust of institutions or healthcare, national healthcare advisor. But in a post-COVID world, that becomes a real challenge, and I don't want to be political in terms of whether I like RFK, if he's the right messenger or not. But the point is, this is a big issue, right? Who do people believe now? People, trust in healthcare authorities has never been lower in America. And, the question is, how do we overcome all of this?
Well, for years, I'm just being a conspiracy theorist here, but, people have always thought the food industry and the medical industry work hand in hand. Because if they didn't, then y'all would be calling them out all the time, every day, because you're watching them serve this poison to people. So if you actually care, well, I'm not saying y'all, but I'm just saying, yes, I am saying y'all, the medical industry. If y'all actually cared about, people not getting sick off of this food, then every single day y'all would be on these corporations' ass. Corporations would be mad at y'all because y'all would be messing up their money. Y'all would be calling out certain products, certain corporations for selling this BS in the first place. That's why people think that y'all work hand in hand. They get us sick, and then we come to see y'all.
Listen, I never said it was going to be easy having Charlamagne here, okay? All right, it's always a workout when we're together. Well, listen, we appreciate you being here. I appreciate all of you coming and participating. Any final thoughts you might want to add?
No, I guess thank you for having me. Thank you.
And everybody got a copy in paperback of Charlamagne's new book, Get Honest or Die Lying. I'm sure you'll all find it as enjoyable as I did. And as you read it, you'll be hearing Charlamagne in your head because that's the way the book is written. But Charlamagne, thank you so much.
Puma.
Thank you for your advocacy, and thank you for all you do for healthcare in this city.
Dr. Craig. Yes, sir.
Thank you, man. Appreciate it.